So guys, this is Gerald. We just finished an implant for a very front tooth, and we replaced an affected tooth and rebuilt bone and got him an implant in, and he's smiling and chewing, enjoying life now. Tell us how everything went.
Well, certainly I was confident in one sense because my wife had already seen Dr. Godat. I was confident too that my real dentist that I use all the time knew your name and was first to send me here as well. So I have received the greatest care.
Oh.
The staff, from the time you walk in the door, has always been welcoming, and certainly dentists are not everyone's favorite.
Oh, I can't believe that one.
However, when you come in this place, you will change your mind. You will be,
awesome.
you will feel welcomed, and everybody down at every level of the staff are very professional, very helpful.
Awesome.
And I'm glad that I'm in fact complete now. That
Absolutely.
I have a beautiful, as we're looking at the X-rays,
Right.
a beautiful tooth.
Yeah, it really turned out really well. So look at the X-rays. You can see the before with this tooth infected and bone loss around it, and then this is the after the bone rebuilt around the implant. Everything's doing great, and then you can smile and chew in the front now too, can't you?
Very much, it's
All right.
normal again.
That's normal.
And
I
I
love it.
recommend this clinic for anyone and everyone, because there's so many things I was not aware of that are required. We need to take better care of a lot of our mouth and our teeth, our gums, etc. So this is the place. If you were a little behind on it, they can help out, bring you back up to normal.
Well, thank you so much, and you had a good experience for everything, and we're comfortable, I hope, with everything.
Very
too.
much, very much.
Excellent. Well, Gerald, thank you again for allowing us to help you out. You have a blessed weekend.
Yes,
To you and your wife, for both of you and your entire family, and allowing us to help you all be healthy and smile, okay?
Thank you.
Thank you, Gerald.